More racers in this year's women's only virtual 5K means more money raised to help even more women get screened for breast cancer. 898 racers raised a grand total of $35,203.58. All that money will help triad women who otherwise could not afford it to have access to life-saving mammograms, resources, and support they desperately need. The virtual race allowed teams to lace up and walk or run at their own pace during the week-long event. You know, October is Breast Cancer Awareness Month, and for To Your Wellbeing, we are covering the importance of early detection, screenings, and when and where to get them. Cone Health Oncology Outreach Manager Christine Brannock joins us now. When it comes to breast cancer, how important are these early detection screenings?
It's very important because breast cancer, mammograms can find breast cancer before we can even feel them or we have any symptoms. So it's very important for women to have their mammograms at the recommended intervals.
And who should start getting those screenings? At what ages? When do you need to worry about that?
All women that are age 40 and older should begin getting mammograms every year. If you have a family history of breast cancer, usually the rule of thumb is 10 years prior to the youngest relative being diagnosed. For those that are concerned about, they have a strong family history, there is an option to be genetically tested to see if you carry that gene because it does increase your risk slightly.
Besides the age and the family history, are there any warning signs you need to look out for to maybe know to get tested?
Yeah, so you want to look for things like lumps, any changes in the skin, such as any dimpling. The skin could look like the skin of an orange peel. Any changes of size or shape of one breast, any discharge, any pain. For example, if you feel pain in one spot that you feel with 2 fingers or less. So we're more concerned about focal pain.
And that's for women of any age. If you have these symptoms, you need to talk with someone.
Yeah, so if you ever have any of the symptoms, please consult your physician.
And what do you tell them? What kind of conversation should you have?
You should let them know that your symptoms, then your physician will more likely do a breast exam, and then they will probably refer you to get a mammogram. Typically, if you have symptoms, we do a diagnostic mammogram, possibly an ultrasound, just depending on what those symptoms are and your age.
A lot of people might be thinking, I really don't want to have to pay for this extra doctor's visit. Is there help out there if you can't afford it?
Yes, we have wonderful programs here at Cone Health. We have a couple of different options. One of them is our mammography scholarship program, which, as you mentioned, the Women's 5K, that raises funds for that. And that scholarship is for a free mammogram for those women that are 40 and older that have no insurance and meet those income guidelines. We also have another program called the BSEP program. It's the Breast and Cervical Cancer Control Program. Through that program, women that are uninsured and even some that are underinsured can actually get a breast exam, a pap smear, and pelvic exam, and it covers their mammogram and their follow-up. If we were to diagnose a breast or cervical cancer or certain high-grade lesions, then those patients may be eligible for Medicaid to help with their treatment.
So many of us are just really bad about going to the doctor. Why would you tell someone these mammograms are so important?
Because we can find breast cancers before we can even feel them. And the chance of survival is so much greater if we find it earlier. Also, the treatment options, there's so many more options if we find it at a much earlier stage.
What are some of the differences in treatment options if you find it earlier?
Well, there's different options such as surgery, chemotherapy, radiation. It could be a lumpectomy versus a mastectomy. So it just depends. The rule of thumb is there's no cookie cutter approach to how we treat breast cancer. Every patient is unique.
Christine, right now, so many people are worried about going to the doctor because of coronavirus, but you were telling me during the break about a new mobile option instead.
Yes, so we have a new mobile mammogram cancer screening unit, and on that unit you can get your mammograms. That unit is parked at locations across Guilford, Randolph, Rockingham, and Alamance County. So if you are interested in having an appointment on that mobile unit, we also, patients that qualify for the mammography scholarship or come to our BSEP program also can have those mammograms on that mobile unit. You could call the breast center for an appointment on that mobile unit, or if you need assistance through our scholarship or BSEP programs, you can actually call our department number, and that number is 336-832-0849 to get your application for that scholarship. It can also be accessed on the Cone Health website at conehealth.com, and you can just search mammogram scholarship or free mammograms.
How has this whole pandemic changed the way people get screened and how regularly they come to see you?
I know that there was a decrease in screening. I know there was a short period of time that we weren't able to do screening mammograms. Now we follow all COVID safety protocols as far as we try to reduce the amount of patients in the waiting area. The nice thing in the mobile unit, if it's a nice day, patients can always wait outside if they prefer. We make sure everything is cleaned and everything is taken care of like it should be to decrease any risk whatsoever. All staff wears masks when they take care of patients. And all Cone Health employees also wear face protection also.
Does the vaccine have any impact on mammograms? I remember hearing that you're supposed to wait a while before you get a mammogram.
There is no actual association between the COVID vaccine and breast cancer, though what can happen is the vaccine can cause a swollen lymph node in the armpit axilla area, which is basically just your body's natural immune response to the vaccine, and that can potentially show up on the mammogram. There is no association with it in breast cancer, though. Sometimes we do advise patients to wait a few weeks before they schedule their mammogram. Typically, it's about 4 to 6. Though, if a patient does have any symptoms, such as I mentioned earlier, then it's still very important to get your mammogram and not delay any treatment. Then we would do a diagnostic mammogram or whatever follow-up is needed for those patients.
I just can imagine that could lead to some false panic for some women out there.
Yeah, and they may call you back for some additional images just for some reassurance if they were to see something or if you felt something. But again, it is very important to let your provider know when you had your vaccine and let them know any symptoms that you have.
How much does early detection increase your rates of surviving this?
It's tremendous. Right now, currently, we have over 3.5 million women in the United States alone that are breast cancer survivors. So it's very important. And honestly, I've been in this position for almost 20 years, and that is a huge impact compared to what it was then. When many more women are surviving and beating breast cancer. So it's so very important that we get checked out like it's recommended, and that we are aware of what's normal for us, and if we notice any changes, to make sure that we report those changes to our provider. And if a woman doesn't have insurance, to contact us for one of our programs. We will make sure that you get the care that you need and the follow-up that you need.
You know, us guys, we want to help out too. What can we say to the wonderful women in our life to encourage them to go get the mammogram?
It's so very important to take care of your health, and as I have mentioned, and I couldn't say it enough, that the chance of survival and the options of treatment are so much better if we find it early before we were to ever have any symptoms.
Well, thank you so much for your time. We really appreciate your expert insight here. If you missed any of this, we're going to put it all up on our website, WFMYnews2.com. Just check the 2 Wants to Know section.